Okay, so we want to go ahead from where we stopped last week. Last week, we said that you, as a mother, you are the heart of that home. And as you can see on the screen, there is a hand that forms a heart. And that heart is actually covering a family, the father, the mother, and the children. So you are solely responsible for the health of your child as a mother and the health of your family as a whole. You can't afford to play with their health. How much do you know about health of children, about family health? Have you taken any course on it? Have you made any research? Have you spoken to a doctor? Have you spoken to a pediatrician about health of children? Do you have discussion with nurses? Because as I said last week, you are not a nurse, you are not a doctor. And now we are talking about health care. You are not, but you are an assistant, something close to an auxiliary nurse, assisting to ensure that the health of your child or the health of your children or even the health of your family is not lagging. Your children are not going in and out of hospital. It is solely the responsibility of parents and mothers especially that we need. So that shape, that hand is the hand of a mother, and that shape is a heart, signifying the heart of your family, the health of your family. It is in your hand and you are responsible for that. Now I am adding another image there, like a nurse. Okay, so there is no nurse in your house. Therefore, you as a mother, you are the auxiliary nurse playing the role in that home at that particular time. Okay, so having said that, we are also going to look at, okay, we looked at some of these things last week: personal hygiene and safety, medication, immunization, and then this week we are looking at handling domestic emergencies. Last week we talked about personal hygiene and safety. We dwelled so much on that, and we looked at the safety equipment that we can have at home, importance of a first aid box, very important. We looked at the content of a first aid box, and also what we can use first aid box for, the content of the first aid box, what we can use them for. Okay. Then we also looked at fire extinguisher, how to use a fire extinguisher, why we need a fire extinguisher at home. It might not be you that is going to need it. It could be someone close to you, a neighbor, or it can be of help. So it is good for you to have a fire extinguisher. We learned about that, and we also looked at how to use it. We also looked at personal hygiene, the tricks we can use for children to help in brushing their teeth, cutting the nails of our children, very important. We said that most of the infections they have, at times we look outside, we say, where did they go or what? We don't take our time as mothers to look inwards. One of the ways we can help ourselves as mothers is to look inwards. Check your child's nails. Are they not long? Don't they have germs? This can be the major source of the child falling ill often. So we dwelt so much on that. We looked at medication. At times you feel the medication is not working. Why? We will not be able to talk about that today, but we did a lot of that last week. We talked about drug interaction. We talked about food drug interaction. We talked about health, your lifestyle. When you are using a drug and you are working against the drug by your lifestyle, the drug will not work. You are using some things together with the drug, or you are doing some things, you are trying to kill cold and you are exposing the child to cold, the drug will not work. I expose the child to AC and you say you are training the child to get used to AC or whatever you might call it, the drug is not going to work. You are taking some kind of food while the child is on the particular medication and you are complaining the drug is not working, and the doctor forgot to ask you, what are you giving this child to drink? Is it on the happy hour or whatever, and you are increasing the dose, putting the life of the child at risk. So we learned all that last week. It's unfortunate that some of us were not around, but we can still, this program is recorded. We can make arrangements to get the video. So we looked at why drugs don't work, and one of the reasons is the lifestyle, and also because of interactions with the drug in the body. Now we are talking about handling domestic emergency. Let me quickly say here before we move on that there are different aspects of domestic emergencies, and some you might need to get a professional or a practical session to be able to say that you are qualified, so to speak, for this. But for the purpose of this training, this seminar is to expose us to what we are supposed to even know about domestic emergency. What are you supposed to know as a mother? You're supposed to know that there is what we call domestic emergencies, and it can happen. We don't pray for emergency, we don't pray for some things, but some things can happen, and therefore we just have to be prepared. You cannot afford to be moving left and right. For those that are just joining us, you are welcome. You can mute your mic. Say hello and mute your mic. Thank you. So for emergencies, you can't afford that. If everybody is running 360 degrees or running 180, that's running at a point, or running left and right on a straight line, you cannot afford as a mother to do that. Or because you are the one in charge, you just have to start doing something, okay, to rescue that child at that time. Or you find yourself in a situation where that is needed. You have to just help. Okay, so that is a picture of a mother trying to assist the child, and the child has a cut there, and the mother is trying to fix it. So that is what a mother should do. You can't hold your hands. So what are the domestic emergencies that we can have? We can have, it could be external bleed. What do you do when you have external bleed or bleeding? It could be burns. At times, there could be burns, and because nobody prays for it, nobody imagines it. How would you be imagining that something bad will happen? Okay? In our society, if you imagine something bad happens, as if you are a bad person, okay? You are a wicked person. So you don't imagine bad things. That is why you just have to attend trainings like so that you will have the technical know-how. Then you have poisoning. Poisoning does not mean that somebody poisoned the child. Poisoning means that the child has taken a poison, something that is hazardous to that child's health. Okay, not necessarily deliberate. Poisoning it might not be deliberate. Okay, it might be deliberate or not deliberate. Fracture, drowning, okay, unconsciousness, choking, seizure. Those are the things we are going to be looking at today. We have a long day and we have a very short time. I pray God will help us to be able to complete it. So we are going to start right away. The first one is external bleed. We could have different types of external bleed. It could be arterial or venous bleed. It could be capillary bleed. It could be nose bleed. Now, if you are not somebody into biology or medical, you might not really know what is arterial, venous, or capillary bleed. But we are just going to be looking at simple signs that will make you to know what kind of bleeding it is. You don't have to start cramming it because you are not a medical person. That's the arterial types of bleed. No, your own duty is not to cram the types of bleed. And that's not the purpose of this training. It's for you to be able to identify when you see. All right? Arterial or venous. These are the things you do. But before we look at the things you do, how do you know whether a bleeding is arterial or venous? Arterial bleed is when, blood is coming from the heart. And the blood that is coming from the heart is fresh. The heart is pumping blood to all the parts of the body. And as such, the blood is fresh. It is called oxygenated blood. Don't bother yourself with the grammar. But it is fresh. Just like that blood coming from the heart is clean, it's fresh, that is to be circulated to the whole body system for use. So that blood is coming out with a lot of pressure. So if it's an arterial bleed, the blood will be much and it will be pumping like blood. So when you see blood coming out and it's pumping like that and it's fresh, very bright yellow, almost and red, almost getting to yellow, it is arterial. Venous is the blood coming back to the heart, and so it is not clean because it contains other things to be returned from different parts of the body. So the blood is darker. And also that kind of bleeding will also be much. Though not as much as arterial, not like pumping, but it's also much. Okay. Then we have the capillary. That one is a mild injury. The capillary bleed is a mild one that you can easily, dress, and everything will be fine. All right. So what do you do when you have arterial or venous bleed? That is the one that is not okay. You can't just be running up and down as a mother when somebody is bleeding and you don't know what to do. Some people, when they see blood, they are confused. As a mother, the purpose of this training is to tell us that we should not be panicking and getting confused because you are the one in charge at that time. You just have to summon courage and do whatever you have to do quickly. And what you have to do quickly is to first of all stop the bleeding. If it is an infant, you cannot just, because an infant has just about 1 pint of blood or even thereabout, be less, depending on the child. You cannot just be looking at the child or say you want quickly, as you are rushing the child to the hospital, the unexpected happens. What you do is to try, as you are doing whatever you want to do to get help, to stop the bleeding. You stop the bleeding. That's the first thing, that if it is arterial or venous and the bleeding is much, you stop the bleeding. Cover the wound with a sterile dressing. That is, we have talked about sterile dressing in the first aid. We have seen it. A sterile dressing is, if you don't have a first aid kit, look for something that is very clean. Okay, a clean cloth, and that is why you should have a sterile gauze in your first aid box. Okay, so you do that. When you are done with that, you apply pressure until the bleeding stops. You keep pressing it down because you don't want the child to keep bleeding. If the bandage is soaked, you don't remove the bandage. You keep putting more bandage. If you exhaust the bandage, then you use cloth. And anything you can do to apply pressure on that place, as you are rushing the child to wherever, you are applying pressure to ensure that that bleeding stops, because you cannot afford the child to continue to bleed at that pace. Start bandaging in parts farthest from the wound and return. That means you don't start bandaging from the point. Start bandaging from the farthest from the wound, then you bandage across and then return. We are going to look at the process. Watch for paleness, sweaty, and look of consciousness. Okay. Now, if it's capillary bleed, check other body areas for injuries. Clean the wound with running water. Okay, capillary bleeds can just be a skin bruise. You are not stopping any bleeding. Maybe just little blood came out and the blood, you see that the blood is reducing and stopping. So you just clean it under running water, brush it off, then you dress it to keep the wound clean and dry. You don't expose the place unnecessarily. You can apply antibiotic cream if it's just an ordinary bruise. That is okay. But if the bleeding is much, you cannot just put it under running water. At times the bleeding could be much. Some people will go and start pouring spirit or put under water, and something is gushing out like arterial bleed. No, you have to stop the bleeding first by applying pressure. So we want to look at the process of applying pressure. Let's quickly watch a video showing us the process of applying pressure when bleeding is taking place. Okay, so that is the step I just explained now. You cover it with a sterile gauze. Can you see that? Apply pressure. Apply pressure. Why are you applying pressure? You're applying pressure to stop the bleeding. If the bandage is stopped, what do? You apply more. Don't remove the bandage there and the blood will come out again. You know you have applied pressure. So you just need to add, if it's napkin or anything you have, you put it again. Can you see that? If it's soaked, apply another thing, towel, clean towel, put it on it again, apply pressure. That is the first aid when the bleeding is much. Don't be pouring spirit. And you see, you start bandaging from the parts farthest from the place. Then you continue. You can see that there is no time to be running up and down, to be running out of skelter and be panicking. This is what you have to do quickly. No time to run around as the mother. No time to panic. That is what you do. You don't want your child to lose blood. That is what you do. Okay, I left that. Okay, can we see the video now? Okay, I want to be sure we can see the video now so that I can be explaining what is there.
No, ma, we can't see. I can't see the video.
Okay. Just a minute, please. Okay, it's showing now.
Okay, it's showing now.
Please, can anybody alert me if it's showing?
Showing, ma.
All right, so we are starting it right. Sorry about that. Let me know at any point in time if you can't see, because I'll be sharing a lot of things. So we are applying pressure on the wound. We are applying pressure on the wound. It's a clean, it's sterile gauze, because the bleeding is arterial or venous. That means it is much. And so you cannot just be adding spirit or water and the blood is still coming out. What you need at that time is pressure. What you need to apply is pressure. What you need to apply is pressure. Keep applying the pressure, then you start bandaging. Okay, the video is low. That is why I'm taking my time to explain. The watchword in this case is pressure. The watchword is pressure. Applying pressure until the bleeding stops. And that's how you start bandaging it. So as a mother, we cannot just afford to be running after. This is what you should do. Keep bandaging across the point where the bleeding is taking place. As you are doing that, you are applying pressure. Remember, you add as much bandage or whatever you have as possible, just to ensure that the place is properly covered and there is pressure there to prevent further bleeding. Then when you are done with that, you can now go ahead. Sorry about that. Okay, so when we are done with the bandaging, then we can take the child to the hospital for necessary medication. Sure you are checking the child, that the child is active, the child is not too weak. So that is the process of bandaging before you take the child for further medication. Can we see that? It must be very tight to arrest the bleeding. It must be very tight in order to stop the bleeding. All right. So that is that about that. We want to go ahead now to continue from where we stopped. Please, if you cannot see my screen at any point in time, please let me know. Very important. Please, can we see the screen?
Yes, please.
Okay, so the next one, we have talked about, let me quickly go back. We've talked about arterial venous bleeding. That is the one that is much, and you need to apply pressure to stop the bleeding before you take the child to the hospital. Don't carry the child with the blood like that to the hospital. Just while you are making arrangement to go, you have to stop the bleeding, and that is the first stage you do as a mother. The next one is the capillary bleeding. That's the one you can just clean off under running water if you have small bruises. Okay, that's the one you clean under running water, not venous or arterial that the bleeding is much. There is also what we call nosebleed. What do you do? You know, before, what people do when there is bleeding in the nose, they will say, turn your head back, turn your head back. No, you pinch the soft part of the nose and lean forward, not backward. You lean forward so that you can assess the bleed. You pinch the soft part of the nose and lean forward, not backward. Before we were taught that we are supposed to lean backwards. No, it is very dangerous. Leaning backwards can make the blood to go to the to your airway or to any part of the body, and you know, that can also cause choking. You don't want to choke, so you have to lean forward, not backward. The next one is burns. Thermal. Burns could be thermal. It could be electrical or chemical. The deeper the burn, the more severe it is. What do you do when there is a burn? This is another domestic emergency that most times we are scared and we don't know what to do. And for some people that feel they know what to do, they do the wrong things. And that is not good enough. What do you do when you are faced with this kind of a situation? The first thing is to remove from source of burn. Some people, when there is burn, they are so scared that they forget to remove the person from the source. That is as a result of panicking. Remove the clothes or nappy except it is stuck to the skin. You remove anything that to further increase the burning. Cool with cold running water for minimum of 20 minutes until pain is relieved. That is, you take that particular area under a running tap, running water, and you leave the child there until the pain is relieved. So it's not that you just put the child there under running water for like 5 minutes. The reason is because the burn is going deep into it's not on the surface. Even when you feel the surface is cool, it might have entered deep into the skin. You don't know the level to which it has gone. So you don't want to take chances. You just leave the child under running water. You can see what is here is 20 minutes. 20 minutes is a long time for the water to get into the skin. Cover loosely with sterile dressing before you take the child for further medication. You want to take the child somewhere for them to dress the wound, to take care of the wound, this is what you do. So you don't just leave the child with something burning and you are rushing to the chemist or wherever you know you can get first aid and the thing keep on burning. Please, that is very unfair. What you should do is to stop the effect of the heat first, because by the time you get to where you will have the child treated, the burn might have been very bad. It might have done a lot of harm on the child's skin. So the first thing, go under running water. First, that is your own part to play as a mother. And leave it there. Don't just do 5 minutes and then say it's okay. No, you have to leave it there for that coldness to enter further, even past the level to which the heat has gone into the body or the burn has gone into the body. Then you cover loosely, you don't want to expose the place, and then you quickly take the child for further treatment. Of course, you use pain reliever. You use pain relief to minimize the pain. So you can see what that person is doing there. You can see the running water. If you don't have a running water, that means you keep pouring water. So the best thing is to put that particular, if it's your arm or wherever, you put it under running water. And then we need to be very careful as mothers to avoid things that our children, the children that are crawling, avoid what to make them to go there. There was an incident of a child that dipped his hand inside a kettle of boiling water, and the child did not know. That was the first experience for that toddler, and so he did not bring his hand out. He was just shouting there. So we should keep all these things out of reach and out of sight of the children. Anything that will cause a child harm, please, let's keep it out of reach and out of sight of our children. You don't want them to see it. Heat, electrical, socket, anything that can cause injury to them. Please and please, let's remove all the sockets. Let's remove all our kettles. Keep it in a place that the child cannot easily reach. Then what about the chemicals? The chemicals in our homes. That could be the result of the poison. That is the next thing we are talking about. Chemical can also cause heat, when it's concentrated and it pours on somebody, it's like hot water. When a chemical, a concentrated chemical, is poured on a child, it's just like you are going to treat it as a burn because it's going to burn that child. There are some times also when it could be as a result of just ordinary chemical, not concentrated or that can cause burn, but the child can take it in. You can see the screen of different beautiful containers. And these beautiful containers is not Sprite that is there or Apia or Ribena. You can guess what is there. What is there is chemical in those containers, and they kept it in attractive bottles. That is not good enough. We don't keep our chemicals in attractive bottles. Chemicals that we did that when we're talking about safety. You don't keep your detergent, soap, Izal, Hypo in beautiful containers that children will not be able to resist. That when they see it, they will just by all means want to go there and touch. So this kind of thing is not good. It's not safe for the children. It can cause poisoning. A child can go there, let me taste it. Poisoning in children can occur from inhalation, that inhaling or ingesting, touching small amounts of various substances such as chemicals, drugs, cosmetics, gas, and even plants. For those of us that are just joining us, we talked about plants on day one. There are some plants that are not good for the children, it can cause dumbness. The plant is even called dumb plant or mother-in-law's plant or whatever name they call it. Dieffenbachia. Okay, I don't have the picture here, but on that day one, we looked at it. It's a very common plant. It is not good when a child touches that plant and puts that whatever, the sap in the mouth. It is very dangerous. So we should be careful keeping plants, the gas around, drugs, chemicals, cosmetics. These are the things that we are talking about when we say poison. What are the signs of poison? Redness around the mouth or lips, vomiting, difficulty in breathing, drowsiness or unconsciousness. When you see that the child is not okay, the child is behaving somehow, is vomiting, or the child is just vomiting. It could be that the child has taken something. So you quickly check around and find out what that child has taken. So if it's poison, do not give any antidote unless advised by a medical person. Don't say, I know what it is. I heard the story of one mother-in-law that puts an infant. I hope you can still hear me. The mother-in-law gave the child palm oil to take. I don't know what the child took into the body, and the mother-in-law gave her palm oil. And before you know it, the child reacted to that palm oil, and it led to the death of that child. Ordinary palm oil, you know, they say, people say palm oil, nobody reacts to palm oil. But that particular child was too small to take that palm oil. And you know, we are all different. Our body system is different. You don't know the content of palm oil that child was given. And he lost that child just because of that. Do not give antidote when you are not sure of what it is. For poison due to ingestion, try to find out what poison was ingested. Look for the container and follow. Some have instructions on the label, a label where they say, take this if taking overdose, especially in drugs. You know, if there's an overdose or something. For gas, whatever kind of gas, most times, because you know, gas, it means you have inhaled the gas and the child is choking or whatever. You take the child outside, or if it's you, whoever, to a place where there is fresh air. So once you breathe in fresh air, you know, deep breath in and out, you'll be fine. Remove any remaining substance from the mouth. Do not induce vomiting. If the person vomits, turn head to the side to avoid choking. We are going to look at how to turn head to the side, how to avoid choking when somebody is vomiting. We'll still talk more on that later. But please and please, try and find out what that person has taken. As you are rushing the person to the hospital or wherever for medical help, make sure that you know what that child has taken. It will help the doctor to be able to quickly provide solution, or maybe you are calling a doctor. The next thing they will ask you is, what did he take? So you better start looking for what that person has taken. Very, very important. So we have looked at poison in children and how to avoid it. Please and please, let's not put things that can expose our children. We don't even want them to be poisoned at all. So please don't put things in this kind of attractive. Why would Izal be in a very colorful container like this? Why? Why can't it be in a dull container? Most times they do it so that they can sell to attract, you know, the buyers. But if you are the one putting it in such container, is not good. Put it
Yes.
in a container. It is not a drink.
Wow.
The next thing we are going to be talking
eating,
about is fracture. Okay, please, you can mute the mic. The next thing we are going to be looking at is fracture. This occurs usually as a result of falling or outstretched arm, tripping or thrusting. It is called broken arm or leg. I'm particularly interested about in this because, you know, we need to just be very careful. You know, children, they play, and you cannot, at times, you might not know, it might just be a small fall. And you might not know if the fall is something that you need to take the child to the hospital. When children fall, hit their head, and you see that it's much, it's advisable you take that child. Don't say you are putting rub. They need to check up if it's head. And you know, children, the one a child can take is different from the one another child can take. A child might be able to cope with it, but another child might not. So we vary. Some people's skull is very strong and can absorb a lot of shock. They can absorb shock more than one person might be able to absorb shock more than the other. So one rule does not apply to all. It's advisable you take such child for checkup. Check the child if it's the head that the child used to land, if it's arm or whatever, and the child is feeling pain. You hear crack. There is swelling. Sorry, that's not welling, it's swelling. Swelling or bruising. Pain in the injured area. And the pain is aggravating. You are still putting rub. There is a fracture there, and you did not take that child to the hospital. That is not good enough. At times, 1 week, 2 weeks, when you now start, you cannot cope again. Child, you not take the child to the hospital, the child has infection there. It was recently I discovered that there could be infection in that particular place. So it's not only infection is not only in even in bone, there could be bone infection. So we need to be very careful and take the child to the hospital at the right time. Whenever we know that there's a crack, there's a fracture, there's swelling, the pain is increasing, it's becoming more and more. You just have to do something. You can't afford to leave the child like that when the pain is not relieving. So what do you do as the first aid before you take the child to the hospital when you know the child has a fracture? Are you supposed to be twisting it more and more for the child to feel more pain? Okay, so what are we supposed to do? We are going to quickly look at what we are supposed to do there whenever there is a fracture. So please, any video I'm playing, as I said, we are going to be looking at videos. So if my video at any point in time is not showing, please alert me. Okay, please, is it showing? IT, is my video showing, please? Okay, it's as if my video is not showing. I need response, please. Please, I need someone to respond. Is my video showing? Okay, I think someone has responded. Let me quickly check if the video is showing. Oh, not yet. What about now? Madam Damaris, is my video showing now?
No, yes, ma'am.
All right, so I'll have to stop share and start all over again. How about now?
Yes, ma'am.
Is it showing now?
Yes, ma'am.
Okay, so this is a fracture. You can see the lady there is holding a magazine or whatever it is. Something of that size, something of the size of a magazine. Anything available in the house, you pick it up, then you check the arm. Let's say it's on the arm. You immobilize it. Can you see how you do that? You place the magazine right there at that place. So we are assuming that it is on the arm now. You don't want to be twisting the arm and cause further pain. Then you get your bandage. What do you do if you don't have? Wrapper, hair tie, whatever you have. You know you're at home, so you can lay your hands on anything available. If you don't have your first aid box. Remember we did first aid box last week. Please go get yours. So that is the process. You can see you make a loop. Okay, she's trying to make a loop. If we were in class, it would have been a more interesting session because some of us will be asked to come and practice it. But because we are on Zoom now, we won't have the privilege to practice. After making the loop, it's firm, you tie it around the neck. You make another loop and tie. You support the hand so that you relieve the person of that pain of moving the hand here and there. So the person does not have to move the hand. So if it's swelling, you know, one of the symptoms is that it will swell up. You apply the ice pack, or you get your pure water blocked from the fridge. If you don't have ice pack, you place it on top of that point that is swelling in order to prevent further swelling. So have we seen it? It's not for us to be running out of shelter and be twisting the child's arm and get to the hospital. They say, Madam, what have you done to this child? This is what you do. When you get to the hospital, they will know, this is the mother. You have done what you are supposed to do. All right. Okay, so as a mother, you have done what you are supposed to do. So I hope you have seen that. Immobilize the fracture with a magazine, a book, or newspaper. That is what you know, it's not easy for me to just say it in the theory form this way. You might not understand. But that's why we brought in the video so that you can see the process of forming the loop, tying it round. You place the magazine first, then you put it on the child's neck. You can see this is also a picture of this is a ready-made something. You're not praying for your child to have fracture, so you don't have to have this at home. Okay, so you don't have it at home, so this is what you do. You don't have it at home, so this is the procedure. You immobilize the fracture with the magazine, apply ice pack to reduce the swelling, give pain relief, then you seek medical help. Remember, this is just first aid. This is what you do instead of running 360 degrees or running 180 at home. It is not the treatment. You have helped that child to immobilize the fracture. The next thing is to take the child for treatment. Don't manage it at home. Then different things begin to happen. They say there's infection, there's this, there's that. You want to do the right thing. That's got to be a professional mom. Drowning, this one is not common at home, but you might have a swimming pool, you might have whatever, or you went out, God forbid, or you know somebody. Seek for help. Get the child out of the water. Check for breathing. Look, listen, and feel. That means you are checking you bend close to the child's nose and you look to the side to check up and see whether the child is actually breathing. You want to check whether the child is breathing. So you look, listen, and feel. If there is no breathing or pulse, start CPR. Training is required. While you are doing this CPR, you are ensuring that somebody is already seeking medical attention. Because as I said, I've been saying in this series, you are not a doctor, you are not a teacher, you are not a nutritionist, you don't have any of this profession, but you just know what to do to help your child. Your own is that you want to help your child. So for CPR training, training is required for CPR. Even though we are going to be looking at the process here, the procedure, for you to be able to know that there is what we call CPR. As a mother, you should know there is something called CPR. Even if you cannot go for the training, it's good every mother has that training, especially if you are a teacher, you are a mother, it's good. If you can afford the training, you go for the training. But what is CPR? That's the first step, and that's why we are organizing this training. You should even know that there is something called CPR. No child should be suffering where you are there because you know what to do. CPR is cardiopulmonary resuscitation. Cardiopulmonary resuscitation. What is cardiopulmonary resuscitation? We are going to be looking at it. But please, in this training, the purpose of this training is for you to be aware and to see the process, what it is. You might require to go for a training, and in that training, you will actually be asked to practice it. Okay, while I went for my own training, you can't say you have CPR training if you didn't do it in the presence of the trainer. So I can't say I've trained you for CPR, and I'm not going to train anybody for CPR because I'm not certified to train for CPR. So I won't do that. But for you to see and know what it is, and if you like to go for that training to know what to do, and in the training, you will be required to do it in the presence of the trainer. That is when you can say you have been trained. If you have not done it in the presence of a trainer, please, you have not been trained. So what you do is to ensure that the child survives, and that's why I say do CPR. If the child is not breathing, no breathing, no pulse. Or maybe there is even pulse. A sign that the child is still alive, but there is no breathing, you still do CPR. So breathing is the underlining, or maybe the breathing is not okay. The child cannot survive without breathing, you still go ahead and do CPR. Then you get medical help. While you are doing the CPR, you can quickly get someone to, when you are doing CPR, it's not for you to just stay and do CPR because you're not sure whether the CPR will work or not. You still need to, first of all, get the attention of someone quickly, assist to take the child to the hospital or to get a medical practitioner or whatever. Then while you are waiting for that is when you do this first aid called CPR. While you are waiting for that, when you do the first aid called CPR. So we'll look at CPR in the next discussion because we are still going to talk about CPR in the next discussion. So we'll just go ahead to the next discussion. And that is when you find a child unconscious. The child is unconscious, that means the child is not breathing. Whether breathing or not breathing, the child is unconscious. Check the scene for safety. Check for responsiveness or breathing. Tap the shoulder and shout, "Are you okay?" For infants, you may flick the bottom of the foot. Check for not more than 10 seconds. 10 seconds. That means all what we are saying is that there is no time to be panicking. As a mother, the little time you have is to do first aid. The little time you have is to seek for help and do first aid. If the child or infant is face down, roll face up, supporting the head, the neck, and back in a straight line. Place the child on a flat, hard surface. Now, open the airway, give 5 rescue breaths. As I said, this rescue breath is for those that have been trained in CPR. If you have not been trained in CPR, I don't know what to do. So I'm going to show us a video of what CPR is all about and so that you will know that, okay, I need to go for this training so that I'll be able to, help other people, or maybe you deal with children, you help to assist. If it's a child, that is someone that's not an infant, there's a procedure. If it's an infant, depending on the age, if the child is very small, it's very small baby, like 1 month, there's something to do. If the child is older, maybe like 9 months, 8 months, there's what you can do. If the child is like 3 years, 5 years, there's what you can do, okay, in the process of CPR. So CPR, as I said, means cardiopulmonary resuscitation. It involves 2 processes, as the name implies. Cardio, pulmonary. The cardio is the chest compression. You are compressing the chest. You are doing what the heart is supposed to do. That's chest compression. Chest compression is when you are doing what the heart is supposed to do. And that is the cardio part of CPR. Then the pulmonary part is what we are calling rescue breath. That is, you are helping the child to breathe. In school in those days, we call it kiss of life when we are studying biology. Remember kiss of life? That is the rescue breath. Then the chest compression, maybe some of us don't know that. That is what you are doing, what the heart is supposed to do. Give 30 chest compression within 18 to 20 seconds. Look for and remove objects if seen. Then for rescue breath, tilt the head back slightly, lift chin up. We are going to be looking at the process. Child, pinch the nose if it's a child. That's a grown-up child. Pinch the nose, shut, that's to close the nose. Then make a complete seal over the child's mouth. This requires training, as I said. Then you push, that you breathe, you push air into that child with your mouth. It's called mouth-to-mouth resuscitation or kiss of life. Okay? Then if it's infant, you cover the nose and mouth with that handkerchief or whatever you are using. Then you push air into the child's mouth, through the child's mouth. You push air through the child's mouth. And as you are doing that, you are pushing the air, you are checking, can the child breathe now? Once the child can breathe, then the medical personnel arrives and they start treating the child. But this is what you do as a first aid. Okay, so I want to share my screen again so that I will not just be talking and we are not getting a feel for what I'm saying. We want to get a feel. Okay, let me just go back to the other video. I think it's easier this way. Can we see it? So that I will not have to close the video again. Okay, please give me some minutes. I don't want to go out of this environment so that it can be easy for us to continue. These are the videos we have done in the past. If you did not attend the past previous ones, please let's do the needful. So we are starting with the infant. This infant now is very unconscious, and we are trying to see how we can revive the child. The first step is to quickly go out and look for help before you come back to the child, as I said earlier. The first thing to do is to go to seek for help before you come back to the child. After seeking for help, because the child is not breathing, you start CPR. You raise the baby's head up. That's not a live baby, you know, that's a dog. So it's not easy to raise the head up. You raise the head up to open the airway. You cover the nose and mouth while the airway is open, the mouth and the airway, then you begin to give rescue breath. Complete seal. There should be no space between your mouth and the child's mouth. Complete seal. So you need a training for it. That's why I say you need a training, because it's not enough for me to just tell you this way. Okay, I was not taught like that. I actually carried out the process. Then the trainer will tell you have done it well. or not. So you blow in 2 breaths, then you start your chest compression. Everything should be within 18 seconds. Can you see where she's putting her fingers? 2 fingers in between the lower part of the breast. Okay, so because she's talking, you might not get the voice. Tick tock, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. When you get to 30, you do 2 rescue breaths again. 1, 2. Then you continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then you give another round of breath. Okay? That is for the infant. What of for a child? Sorry? For a child. I hope you can still see the screen. So for a child, you don't cover the nose and mouth. You pinch the nose, then you breathe in air with your mouth. It's called mouth to mouth. Mouth to mouth. As you are doing it, you are looking at the child's chest if breathing has occurred. You look, you listen. As you are doing it, you are checking whether the child will come up again. If the child does not come up, then you do chest compression. Okay, you start your compression. So we are going to be looking at the proper way to be able to do that. Okay, I hope you can still see. So that's what I mean by chest compression and rescue breath. Chest compression, as I said earlier, it needs training. You cannot just say that you have watched it, you know how to do it. You need to get a professional to watch you doing it, because that was how I was trained, and that's how the training is supposed to be done. Conscious choking. That's the next one. Conscious choking. After checking the scene and the injured or ill child, have someone call for help. You just discover that the child is choking. You don't even know the cause. But at times you know the cause. If you know the cause, fine. If you don't know the cause, then what do? If it's a child, give the child 5 back blows, and that is the position that you're going to put the child on. Bend the child forward at the waist and give 5 back blows between the shoulder blade with the heel of one hand. Can you see the position? Then you begin to give the child 5 back blows in between the shoulder blades, not anywhere. You are not tapping the child, you are giving the blow, and that is the position you are seeing on the screen so that the thing can come out. So as you are giving the child blow 1, check if it has come out. Blow 2, check. It's not that you are going to put your hand inside the child's mouth and start pushing that thing inside. No. You are not going to be pushing the object that has choked that child inside further. You don't want that to happen. So you are going to turn the child almost upside down, not upside down. You can see tilted. Then you begin to give the blow and checking the mouth, whether the thing has come to the mouth. If that did not work, then you turn the child face up again and do chest compression. Do chest compression. We are going to see that also. If it did not work, if it's an infant, you do chest compression. But if it's an adult, like a child that's already of this age you are seeing on the screen, you can do what we call abdominal thrust. You can do abdominal thrust. So we are going to also look at the process of the abdominal thrust so that we can understand. Place a fist with the thumb side. Where you are going to put that fist is going to be a little bit above the navel. Okay, it's going to be a little bit above the navel, that part. Then you cover with your right hand. You're going to use your left hand to make a fist. Then you use your right hand, depending on who you are. The stronger hand is the one that will control. So my own hand, right hand, is the stronger hand. So that's what I'm going to use to support. So anything you are doing, use your the stronger hand as your support. Maybe you want to press something now. The weaker hand will be down. The stronger hand will be up. Do you understand? When you want to you want to apply any form of pressure, your weaker hand should be down, while your stronger hand should be up. So that is how to go through the process of compression and abdominal thrust. If it's an infant, you can't do this. You can see this boy is standing. It's not an infant. You can't do abdominal thrust. What you do is to do chest compression, just like an unconscious child. So if the child is choking too, you do chest compression. So we are going to be looking at the whole process of choking, what choking is all about, and what causes choking.
We are talking about choking prevention.
Please, can we see the screen? Please, can somebody tell me if you are seeing the screen now? Hello, is it showing? Hello?
I can see your screen. I can see your screen.
Thank you very much. God bless you. So we can continue.
You're welcome.
We are talking about choking prevention, recognition, and response. When it comes to prevention of choking, there are 3 key things that we need to do. First of all, we need to be aware of different objects around our house that we need to keep out of reach of children. And here are some common objects that I've actually collected from around my own home. You can certainly see that there are so many things. It's almost anything in your house that a child can choke on. Everything from lollipops to pieces of Lego. Certainly, sometimes things you don't even think about, like leaves can actually cause a airway. And certainly things like hair clips, coins, and most importantly, we need to remember to keep button batteries out of reach, because not only are they a choking hazard, but they can also cause terrible burns in children. Now, the other thing that we need to consider when it comes to food is the size of what we chop up into, particularly grapes and sausages. Now, often when we think of a grape, that is the perfect size to lodge in a child's airway. So please, always remember, chop up the grapes. Chopping them in half is still that perfect spherical shape to lodge in a child's airway. Please make sure that we're chopping them up into quarters. And if you don't have time to chop them into quarters, just squish them. We just don't want them to be that lovely round shape. When it comes to sausages, often we'll just cut them into circles, thinking they're a nice small bit for a child. But once again, that perfect circle is the right size to lodge in a child's airway. So always chop up your sausages into batons. It is better for a child to chew on one of these than to have that perfect circle lodged in their airway. Think about other types of foods as well. Young children shouldn't be eating whole nuts. Popcorn can be quite dangerous to lodge in their airway too. Perfectly fine for older kids, but be really cautious with younger ones. When it also comes to prevention, what I encourage you to do is get your children to sit down to eat. Children who run around with objects or food in their mouth are more likely to choke. And also, make sure you keep young children in your direct line of sight. It can be really tempting just to nip off and have a quick shower while your child is settled in their high chair. But what's really important is to remember that choking can be silent. Always keep young children in your line of sight, watching them while they're eating. When it comes to recognising choking in children, it's really important to understand that choking is different to gagging. Gagging is a completely normal response. You may notice when you introduce solids to your child that, the first little while when you're doing that, you'll pop a spoonful of food in their mouth and they will gag, they will vomit that food up. They'll then pick it up again and start eating it again, and it's disgusting, but it's completely normal. So remember, your child, when they gag, they may get a little bit red in the face. They may have watery eyes. They may cough. They may vomit that piece of food up. But they're not distressed and they're able to clear it themselves. Choking is different. Choking is when something is lodged in their airway or esophagus. They are in distress and we need to help them. If your child is choking, this is what you're going to do. Firstly, if they are unconscious, you need to go through doctor's ABCD. If your child has what we call a strong, effective cough, that is, they're able to take a big breath in and a big cough out, then what you're going to do is encourage them to keep coughing. Now, you may be tempted to go and stick your fingers in your child's mouth and try and pick out whatever is in there. Please be cautious, because if you do this, you may push that object further down. If the object is at the front of the mouth and you can easily remove it, please do so. Otherwise, leave it there. If their cough is strong and effective, simply encourage them to keep coughing and watch them closely. If your child has an ineffective cough or they're silent, so they are, or that's not a strong lungful of air in or out, then we need to intervene. We're going to take the baby out of the high chair or whatever it is that they're in. We're going to lay them down across our laps. Hold them so that you're not going to drop them. Ideally, we want their bottom higher than their head. And we're going to give back blows and chest thrusts. A back blow is not a whack on the back using the heel of your hand between their shoulder blades. It is a firm try and pop that object out. We can give up to 5 back blows, followed by up to 5 chest thrusts. So, 1, 2, 3, 4, 5. Checking after each blow to see if the object has come out. If the object comes out after the first one, you don't need to give all 5. If the object does not come out, turn your child over. Once again, bottom higher than their head and holding them firmly. We're going to give chest thrusts. 2 fingers for a small baby, heel of your hand for a bigger baby or child. On the centre of their chest, over the hard breastbone. This is not on their tummy. We are not doing Heimlich maneuver in children. We're going to give up to 5 chest thrusts. 1, 2, 3, 4, 5. If that hasn't worked, turn them back over. Go back into your back blows again and continue. 5, 5, 5, 5, until either the object comes out or they become unconscious when you're going through doctor's ABCD. If after the first 5 back blows that the object has not come out, it is important that you call for an ambulance. Do back blows and chest thrusts on an older child who is too big to put across your lap. And please hold them in your arms. Back blows between the shoulder blades. 1, 2, 3, 4, 5. And for chest thrust, awesome. Hand on top of that hard breastbone, remember not over the tummy, and up to 5 chest thrusts. 1, 2, 3, 4, 5. If your child is taller and you can't support them properly, simply get them to sit in a chair to do chest thrusts or even lean them up against the wall.
Okay. So I'm sure we've seen that. I want us to look at now, if it's an infant, you might not use the heel of your hand. That might be too much for that infant. So I want us to quickly look at this video I made. It's showing us the, so you want to do the back now. The intensity of the blow depends on the child. Can you see what that person is doing now? Because that baby is smaller. That baby is smaller. You cannot afford to use your whole heel. So that's why I said a professional training is required for you to know the age of the child. You don't just start hitting a child too much. And as you are doing it, check if the thing is coming out or not. Don't just continue. Always check that that particular thing has come out. So if it doesn't come out at that time, you turn the child forward again, and then you do chest thrust, depending on the age of the child. If you are doing chest thrust, you can either use your 2 fingers, as I said, if it's a new baby, infant, baby is still small. You can see what this person is doing now, because this child is not as old as the other one. So she's using her fist. You can even use finger, depending on the age of the child. All these, where you are going to use Depends on the age of the child. The one that knows how young your child is, what your child will be able to bear. Okay, so that is that on that. And as I said, this process requires training. That means you should do it where somebody that is certified is. So that person that's certified is training you, then you will do the practical. If you don't do the practical, that means you have not been trained. Until you do the practical and you are being observed. Okay, that is when you can say that you have gone through the training. Okay, I learned that the last one I shared was not showing. So I want to confirm, can we see the screen now? Okay, so why am I so particular about choking? I remember I once had an experience of a child, and that is why I talk about the things we put around children. Some toys are not good for children. It's not all toys. I said at the first meeting, that it's not about how many toys your children have. It is about how safe those toys are. Even if it's only 2 toys your children have, you know that the toys are safe for them. Then if you now have more than, if it's not a child, there are 2 or 3, you have to know the kind of children you have. Know the ones that can throw things. Some children like throwing. And if you now put what is dangerous in that child's hand and the child threw it and injured the other child, then you will be the one to blame that kept that thing as a toy. So please, there are some toys that are not okay. Then for this choking of a thing, we saw the other video talking about the things that can choke children. Beads. Putting beads in the mouth, in the nose, it can cause problem for children. Even sweet. For a child that cannot chew the sweet, the child can swallow the sweet and the sweet can choke the child. We saw the video. Then there is a particular toy. It's like ball. It's very common in our environment now. The toy is like a ball, but it is made of foam. I don't know if you have seen that toy. You can send me a message if you know the toy I'm talking about. This toy is not good for children because it's made of foam and it's very attractive. A child can just go and bite it and it will cut because it's foam. And that particular thing has choked a child before. And if not for this chest struck and hitting the back, that was what helped the child. And that is why we should know all these things. How to help a child that is choking. Place 2 fingers in the chest just below the nipple line and compress the breastbone. 2 fingers or fist or heel of your palm, depending on the age of the child. 2 fingers or fist, 2 parts of the fist, 2 fingers or heel, depending on the age of your child. Then if your child is old enough, you can do abdominal thrust. If you have done chest compression, it's not working, you can do abdominal thrust. Just a little above the abdomen, you make a fist and thrust up. Okay, cover your fist with your other hand, give 5 quick upward abdominal thrust. When you do that, whatever is in that child's throat will quickly jump out. It is very important we do this immediately. If the child is not breathing, the child is struggling breathing. But as you watch in the video, if the child is coughing very well and the cough is effective, that cough can bring out that thing. But if the child cannot cough, you know, children are different. Some children know how to struggle for survival. Some cannot. So you need to assist with that blow at the back. You need to assist that child with the blow at the back so that the child can be able to bring out that thing. If the child is not bringing it out by that blow, don't put your hand in the child's throat and make worsen the case. Except the thing is in the mouth, then you bring it out. Don't push whatever it is in further. So that is that about conscious choking. When the child is unconscious, what do? Remember, CPR is what you do. You can go for training in CPR so that you know it better. 30 chest compression, 2 rescue breath. 32. 32. That is what you do in the case of a child unconscious. 30 chest compression, then 2 rescue breaths, and you are already, while you are doing that, you are already taking the child to the hospital. Why do you need to put the child on a flat surface? You know, we said place the child on a flat hard surface before you start CPR. If you put the child on the bed, your CPR will not work because it's pushing. It will be cushioning the effect of the pressure you are putting, so it will not work. You have to kneel down beside the child and start chest compression, and it has to be a hard surface for it to be effective. It has to be a hard surface for your chest compression to be effective. And if it's choking, as I said, that is the position, and that is how you give the child the blow at the back. And you see the position? Okay, you support the head and the neck, very important. Then you balance the child with your entire arm while you give the back blow. Whatever is there will come out. Is it bone? Is it whatever it is, to bring it out forcefully. All right, finally, seizure or convulsion, as the case may be. What is the cause? Raised body temperature, usually when there's an infection. Symptoms: no response, vigorous shaking with clenched fist, fever, high temperature, vomiting. These are the symptoms of seizure or convulsion. Maybe in the night, everybody is sleeping, nobody is watching, and that's why we said you should always check the temperature of your child when the child is ill. As a mother, as a professional mom, you don't sleep off. You keep checking the child's temperature to ensure that the temperature is not high. If it's high, quickly apply first aid. You give the child what will bring the temperature down. Take the child to the hospital. So, convulsion can be as a result of raised temperature. When temperature is too high, as a result of infection most times, and the child cannot cope with the temperature or the convulsion. The symptoms: no response, vigorous shaking with clenched fist, fever, high temperature, vomiting. Avoid crowding the victim whenever this occurs. Keep sharp, hard objects away from the person. Loose, tight neck or head weight. Make sure the person is free, and place the victim on the side, especially when the person is vomiting or bringing something out. Keep the victim on the side to keep airway clear. Remember, I said I was going to show you the position. So this is the position of how to keep a person that is vomiting, or the person is, so that the person will not choke. Something is coming out. You need to place that person in that position to keep the airway clear. So as the person is bringing whatever out, the airway is clear for the person to still breathe. Remember, you want to avoid choking. Don't put anything in the person's mouth to avoid injuries. Further, you don't go and injure the person. At the end of the day, all the teeth removed or had a serious wound. Time the period of the seizure for doctor's inquiry, because doctor will ask you, how often has this happened? Has it happened before? How many times did it happen? Then the one that happened last, how long did it take? Because these are things that should be put in the child's record. Okay? These are things that will be put in the child's record so that the doctor will be able to prescribe the right thing for the child. So that is the position, and you don't injure the child, you leave the child while you are taking medical attention. When the child revives, you can give the child pain relief. Make sure you take the child for medical attention. Yeah, so that's that. We are going to stop today. What have we done so far? Let's quickly run through before we ask our questions. We have talked about a lot of things, poison, we talked about bonds. Okay, we talked about poison, we talked about bonds. We said there are different types of bonds, thermal, electrical, chemical. And we looked at the things that can cause it, different types of bleeds, external bleeds, capillary bleed, nose bleed, venous bleed, arterial bleed. Okay, so external bleed, burns, poisons, fracture, drowning, unconsciousness, choking, and seizure. These are the things we need to look at. And if you feel you still need further training in all these things so that you can equip yourself better and also practicalize some of these things like the CPR. There are people that are into CPR. The training, if you know you deal with children, these are the things that we need to know. Remember, you have a first aid box in your house and keep your house safe. The containers in your house should be well labeled. Don't put things that are dangerous in attractive containers. Keep everything out of reach of children, boiling water, chemicals. Make sure your house is safe for your child. Thank you and God bless you. Any questions before we go? Let's take one or two questions. You can unmute your mic now. Comments and questions, please, before we go. Any questions, comments, contributions? Can you hear me? Hello?
Yeah, we can hear you, Mom.
All right. Any questions or comments before we go? We are done with it. Okay, I think there's a comment here. Let me check the chat. Okay, someone is saying thank you. That was very informative. All right, thank you, Fisayo. Okay, we'll talk after this program now. All right, we have a lot of things to discuss. Okay, in the absence of further comments or questions, any other further comments or questions? Thank you very much for joining. Guess what? Next week is gonna be interesting because we will be talking about nutrition. Next week, we'll be talking about nutrition. What are the things we are supposed to give our children? How do we give our children food? What are you supposed to give them? What are you not supposed to give them? And how do you give them? What's the proportion? Please join me next week. Don't miss seminar. Thank you very much for coming and God bless.
Thank you, Ma.